This is an Andy's Randomness special report. Reporting now, Andy Pollock.
Good afternoon. Well, good morning, everyone. Well, almost afternoon. It's 11:41, and we're gonna be going to the tape in just a second for Mr. New Yorkers Love Me, aka our governor, Andrew Mark Cuomo's daily COVID-19 briefing. Now, this is the time of the day where once again I go on to YouTube and ask for your support for our dire need here in New York State. Alright? So, the daily call once again is to remind everybody that Long Island and New York City, this is a far cry for the world, rest of the United States right now. We need help here in New York City and in Long Island right now. Right now, New York City and Long Island, I'll go into it very briefly every day. We are in desperate need of ventilators. Our supplies are running very, very low. We are forecasted to have none ventilators this upcoming Tuesday, April 7th, for all New York City and Long Island hospitals. At this rate, we are dire need. So, please, you can call this number anywhere in the United States, even in the world if you have a country. Hang on, does the United States even have a country code? Yeah, I'm just curious. So I know if you call internationally, you have to dial in a country code, I think it is. Yeah, here we go. The country code is... Oh, okay, so it's 1. Okay, it's 1. International. I'll just double check. Yeah, okay, so you have to dial 1 if you're calling outside of the U.S. So I'll just give the phone number, or it could be long distance in the country if you're using a landline. So the phone number is 21. This is our New York State COVID-19 donation line. Once again, it could be ventilators, face masks, gloves. 212-803-3100. Once again, 212-803-3100. I'm going to put the phone number in the description below every day so you can at least be informed. Because, again, we need help in New York City and Long Island. I don't know how this is going to play out, but we'll just have to take it day by day. But COVID-19 supplies at esd.ny.gov. Once again, please make sure to remember these. Remember these because it's going to be very important. Now, today, I'll mention what I expect to hear from Cuomo. Honestly, I just think we're going to hear more numbers like we normally do, I guess. I will mention that once again, Long Island is going to see a lot of cases. Because with Long Island and New York in this downstate region, we're supposed to have the best hospitals in Long Island and in New York City. I think Westchester may have something like that too, but I'm not that sure. But we're in a situation where, once again, we're running low on ventilators. We desperately need them right now. And I think the Javits Hospital is going to open on Monday, which is good news. And I will mention, I was watching Inside Edition last night. And I'm kind of disturbed to hear that ship that was sent out from Virginia to New York, they're not putting COVID patients in there. And I'm thinking, all right, we asked the feds for help. They sent us a ship. And we're not putting COVID patients on there right now, which is so stupid. But this is how the government works in New York City. De Blasio's playing politics again. Cuomo wants to get involved. But once again, we know what happens. My mayor tries to Cuomo, it seems. Can't that be great right now? Yeah, Justin, I will say this. This is one of my friends in Long Beach. He's actually watching the stream. I thank him for that. What was I gonna say? Yeah, I will say this, Justin. A lot of people are getting discharged, which is very good news. That's excellent because we're in a situation right now where, again, I'll mention this before we get to the tape. Laura Curran out in Nassau yesterday said that you guys, and I even talked to you yesterday on the phone about this, Justin, was that you guys in Nassau, I don't know how Suffolk's going to work out because I do have friends in Suffolk, but, I don't want to reach out to them because, I don't speak to them that often. But Nassau is a smaller county size-wise. You guys do have good hospitals like Winthrop, especially where I work, LIJ and New Hyde Park. You have Syosset. You have North Shore. But what I'm assuming right now is they're not even going to have enough ventilators. So it's going to be an overwhelming situation, I think. It's something that, again, we take day by day. It's something that, we just can't rant about today, and then when we really have to rant, then all our energy gets wasted on it. But, yeah, I think we'll get to the tape in just a second. So I do want to get to the tape. Okay, let's see if I can put the window capture on. Okay, there we go, folks. We are now at the tape. So now we're going to watch Andrew Cuomo's daily briefing.
Happy Saturday. We have our press office friends out of quarantine, looking very healthy. They have 14 days in quarantine. They have to take vacation time for those 14 days. Let's go through some numbers. The increase continues. We're up to 10,482 cases. 23,000 people were tested yesterday. That's the highest number of testing we've ever done. That's good news. 283,000 total tested. Number of new cases, 10,841. New high. Total hospitalizations, 15,000 people currently hospitalized, 4,000 ICU patients, 10,000 patients discharged, right? That's the good news. Number of deaths, all-time increase up to 3,565. Most impacted states, you see New York at the top again. New Jersey has a serious problem in New Jersey and a growing problem. Then Michigan, then California, then Massachusetts. Total number of hospitalized is down a blip, but we believe that's not statistically meaningful. You have the number of ICU cases are up. The number of intubations are up. The number of discharges are also up. And this is interesting. 2/3 of the people who have been hospitalized have been discharged, okay? 2/3 of the people who have been hospitalized have been discharged. That's what we've been saying all along. Most people won't be hospitalized. People who are hospitalized will come in, be treated, and leave. That's 2/3. 1/3 of that number has a serious condition which will require continued hospitalization. We're tracking the growth of the number of infections by hospital, and we can see just where the numbers are increasing. We've been talking about hitting the apex. The apex is the point where the number of infections on a daily basis is at the high point, and that is the ultimate challenge for the healthcare system. Can we handle that number of cases at the high point of the curve? I call it the battle of the mountaintop because that's what it's going to be. That's going to be the number one point of engagement of the enemy. By the numbers, we're not yet at the apex. We're getting closer. Depending on whose model you look at, they'll say 4, 5, 6, 7 days. Some people go out 14 days. But our reading of the projections is we're somewhere in the 7-day range, 4, 5, 6, 7, 8-day range. Nobody can give you a specific number, which makes it very frustrating to plan when they can't give you a specific number or a specific date, but we're in that range. So we're not yet at the apex. Part of me would like to be at the apex and just let's do it. But there's part of me that says it's good that we're not at the apex because we're not yet ready for the apex either. We're not yet ready for the high point. We're still working on the capacity of the system. The more time we have to improve the capacity of the system, the better. And the capacity of the healthcare system, beds, staff, equipment. We're going to be doing a conference call with all the hospitals today to coordinate equipment deployment. Watching the spread of the rate of infections is interesting. This chart is what we've been talking about, but you can see it here. The upstate number is the top bar. Rest of New York has been fairly constant, 4%, 5%, 4%, 5%. Westchester, Rockland, 8%, 6%, 6%, 7%, 7, 7, 7. Long Island is the area that is growing. And you see Long Island goes from 16% to 17% to 18% to 19% to 20% to 22%. New York City is actually dropping as the number of cases in New York City, in Long Island increases as a percentage of cases within the state. For us, this is about tracking the virus, tracking the spread of the virus, and then deploying as the numbers suggest. In terms of beds, the 2,500 bed facility at Javits is going to make a major difference. That has to work. The White House agreed to make that a COVID positive facility. Remember, originally, the Javits Center, which is a state convention center, we worked with the federal government. They constructed a 2,500 bed facility. It was supposed to be non-COVID. I spoke to the president, transferred that with his intervention to a COVID facility. The federal government will staff that, and the federal government will equip that. That is a big deal because that 2,500 bed facility will relieve a lot of pressure on the downstate system. That's a significant number of beds, and that facility now has to make that transition quickly, and that's what we're focused on. It's going to be very staff intensive, very equipment intensive, but the theory there is to best we can relieve the entire hospital system downstate by bringing those COVID patients to Javits and from the intake to the treatment. And it's going to be very difficult to run that large a facility. But if that works, and if that works well, that changes the numbers dramatically. So that's a top focus for us. I spoke to the White House today on planning the logistical operation to get that up and get that running ASAP. And that's the top operational priority. In terms of staffing, we have 85,000 volunteers, 22,000 out-of-state volunteers. How amazing is that? 85,000 volunteers. I'm also signing an executive order to allow medical students who are slated to graduate to begin practicing. We need doctors, we need nurses, so we're going to expedite that. On ventilators, remember we ordered 17,000 ventilators. To give you an idea of how many 17,000 is, the federal stockpile was about 10,000 ventilators for the nation. We ordered 17,000 just for the state of New York. And when we ordered the ventilators, we were paying for the ventilators. So trust me, you know the situation, financial situation of the state. We were not looking to spend a penny that we didn't have to spend. And we placed that order for the ventilators, and we were paying for that order. That order never came through. And this goes back to the China situation. We had signed documents, we placed the order. Governor Baker talks about this in Massachusetts. But then you get a call that says we can't fill that order because you had all that demand going in. So what do? We find what equipment we have, we use it the best we can. If you ask hospitals today, what ventilators do you have that are unused and available that they don't need in the short term, and take 20% of that number of available ventilators, that's 500 ventilators. 500 ventilators is a significant number now. China is remarkably the repository for all of these orders, ventilators, PPE, it all goes back to China, which long term, we have to figure out why we wound up in this situation where we don't have the manufacturing capacity in this country. I understand supply chain issues, I understand the cost of manufacturing, but there's a public health reason, as we've all learned the hard way, why we need the capacity in this country to do this. But anyway, it all comes back to China. So New York has been shopping in China. We're not really China experts here. International relations is not what we do on a daily basis. I've been to China before. When I was HUD Secretary, I did a trade mission with China. So I have a basic understanding, but we went to the Asia Society to help us navigate China. I asked the White House to help us navigate China. I spoke to the ambassador, and we got really good news today that the Chinese government is going to facilitate a donation of 1,000 ventilators that will come into JFK today. And I want to thank Joe Tsai and Clara Tsai and Jack Ma from Alibaba and the Nets, but I'm not stating a preference, for their donation. That's going to be very helpful, and I want to thank Ambassador Wang very much for his help in making all of this happen, because this is a big deal, and it's going to make a significant difference for us. Also, the state of Oregon contacted us and is going to send 140 ventilators, which is, I tell you, just astonishing and unexpected. And I want to thank Governor Brown. I want to thank all of the people in the state of Oregon for their thoughtfulness. Again, this was unsolicited, but the 140 ventilators will make a difference. And I was thinking about it on behalf of New York and what it means for Oregon. First, it was a kind gesture. I know Governor Brown, and she is a kind person, but it's also smart from the point of view of Oregon. Why? Because we're all in the same battle here. And the battle is stopping the spread of the virus, right? Look at what they did in China. It was in the Wuhan province. First order of business was contain the virus in Wuhan. Why? Because you want to contain the enemy. That's always the first step. Oregon, we're dealing with it now. We don't stop the spread in New York. It continues. And if you look at the projections, it could get to Oregon that could have a significant problem towards May. Our problem is now. So it's also smart from Oregon's self-interest. They see the fire spreading, stop the fire where it is before it gets to my home. That was the Wuhan province. Somebody sent me a great quote from FDR, who had such a beautiful way of taking complicated issues and communicating it in common sense language. And FDR was dealing with trying to get the Lend-Lease program approved and accepted by the public. Why would this country help another country fight its war? And that was the Lend-Lease program. And his point was, it's a common enemy, and we want to contain the enemy. And that other country's fight is actually our fight. And if we don't stop the spread, then it's going to burn down our own country. But this is how he does it, right? Because the concept is right, but how does he explain that? Suppose my neighbor's home catches fire, and I have a length of garden hose 400 or 500 feet away. If he can take my garden hose and connect it up with his hydrant, I may help him put out his fire. Now, what do? I don't say to him before that operation, neighbor, my garden hose cost me $15. You have to pay me $15 for it. What is the transaction that goes on? I don't want the $15. I want my garden hose back after the fire is over. All right, if it goes through the fire, all right, intact, without any damage to it, he gives it back to me and thanks me very much for the use of it. But suppose it gets smashed up, holes in it during the fire. We don't have to do too much formality about it, but I say to him, I was glad to lend you that hose. I see I can't use it anymore. It's all smashed up. He says, how many feet of it were there? I tell him there were 150 feet of it. He says, all right, I will replace it. Now, if I get a nice garden hose back, I am in pretty good shape. State of Oregon has lent us 140 ventilators. It was kind, it was smart, stop the virus here, it's better for the state of Oregon, it's better for the nation. Their curve comes after ours. We will return their 140 ventilators, and there's never been a discussion, but frankly, I know New Yorkers, and I know New Yorkers' generosity, and we will return it double-fold, because that's who we are, and that's what we believe. So, stop the fire in New York, kind, generous, also smart. Personal opinion, look, I want this all to be over. It's only gone on for 30 days since our first case. It feels like an entire lifetime. I think we all feel the same. This stresses this country, this state, in a way nothing else has, frankly, in my lifetime. It stresses us on every level. The economy is stressed, the social fabric is stressed, the social systems are stressed, transportation is stressed. It's right across the board. But the most difficult level is the human level. It is for me anyway. And it's every day and it's everywhere. My brother catches the virus. That is stressful. My mother's worried about my brother. And She's concerned. We have a birthday party yesterday for Stephanie. We're standing around a cake. Everybody's 6 feet from each other in this bizarre, what's supposed to be a fun, usual celebration of a birthday. My daughter's cousin hug each other and hold each other. They can't even grieve together. They do these cyber chats. I mean, this is so emotionally taxing that you can't even begin to, you can't even quantify the effect on society and the effect on individuals and the burden that we're dealing with. So yes, I want it over. If there was anything I could do to accelerate getting it over, I would. In some ways, I want to get to that apex. I want to get on the other side of that apex, and let's just slide down that mountain. On the other hand, we have to be ready for the fight, and we have to handle that fight. And that's where we are. So what do? You have to get through it. You have to get through it. There is no simple answer here. You're not going to wish this away. You have to get through it. And you have to get through it intelligently, saving as many lives as you can. And that's hard work, and that's perseverance, and that's mutuality, and that's community, and that's finding your better self, and that's finding your inner strength and dealing with a situation that is almost unmanageable on every level, because you are out of control. And this is a painful, disorienting experience. But we find our best self, our strongest self. This day will end, and we will get through it, and we will get to the other side of the mountain, and we will be the better for it. But we have to do what we have to do between now and then, and that's just what we're doing here. Questions, comments?
So once again, New York Governor Andrew Mark Cuomo giving his daily COVID-19 briefing. Human nature is just... it's just emotionally draining. I completely agree, but... again, it's a day-by-day circumstance of what's going on. And... just checking for fun. Is he still taking questions right now? I'm only... oh, okay, yeah, this is the replay from earlier. Okay. So, I don't think Laura Kern will be giving an update today. I don't see any notifications from News 12. So, I'm probably going to wrap this up shortly. Let me just see if we got any more comments. Well, I will say this, Sandy. I will say this. You know, FDR got us through World War II. So look at it that way. Yeah, and I know last night, if I can find that article from Fox, maybe I'll play it. Let's see if I can find it. Because last night, Channel 5... yeah, here we go. Here's the article. Despite social distancing guidelines, New Yorkers still are overcrowding on the subways.
Despite the coronavirus pandemic and the repeated warnings.
Yeah, let's watch this report from Channel 5 last night. Can I refresh this? Can I refresh this? Here we go. Now I can refresh this. Okay.
Despite the coronavirus pandemic and the...
so I will play the video right now. So I'll refresh it and then we'll start.
pandemic and the repeated warnings from federal, state, and city leaders, these commuters seem to be disregarding social distancing. These pictures show riders crowding onto subway platforms, jamming into trains, squeezing together. Once typical during a global health crisis, now seems incredibly risky. The scene equally dangerous during rush hour on some bus lines.
People have got to use common sense, right? If the train that you are on is getting crowded, get off at the next stop and wait for the next one.
New York City Transit's interim president, Sarah Feinberg, insisting these pictures showing overcrowding are isolated incidents. Ridership is way down since most New Yorkers are staying home. A record number of MTA workers are also out sick, both issues prompting the MTA to reduce service.
We do believe that these instances are pretty sporadic and quite short-lived, and doesn't mean that they don't matter. They certainly do. But, we are doing the best we can while thousands of people are out sick.
People can be contaminated very easily, it's a concern.
New York City Council member Idanis Rodriguez is the chair of the City Council Committee on Transportation. He'd like to see the MTA run more trains and bring retired workers back.
I believe it is important that we make a call for those who are retired, conductors, staff at the train station, to please come back and work.
I asked the MTA's interim president about bringing back retired workers, and she told me it's simply not safe. Instead, she'd like riders to be more careful. Sharon Crowley.
So there you have it. That's what I saw on Channel 5 last night. And, thank goodness that one of my loyal viewers was asking me this question. I was like, you know what? Life has crashed on the subways. And, I'm glad that viewer recommended I should play this video, because this is an idiotic idea. That why would you even think about bringing back retired people when, honestly, that's just the most dumbest thing I could suggest. But I suggested to the mayor today that, why can't we just close off the bridges and tunnels for non-essential people? Because right now, you could have the bridges and tunnels used for essential personnel, like police, fire department, truck drivers, stuff like that, to alleviate congestion on the subway. Because right now, you're putting the MTA workers at great risk, honestly. And the one thing I've been concerned about is Chief of Transit Bureau, Ed De La Torre. I haven't heard from him since... Well, we all haven't heard from him since he was tested positive. And, right now, I do agree with Sarah Feinberg's logic, is that, if you see a train crowded, wait for the next one. Because right now, bottom line is, this is not the time to be going on an overcrowded train. I mean, you can't... I don't know what else to say anymore. I just don't. Especially how, again, the homeless just make everything worse. Joy Jung, what I can tell you right now is we don't have an update for Broadway performances or school. But I'm thinking that's probably going to get extended next week. Most likely. Or the week after. I wouldn't know yet. I wouldn't know. But, yeah, I'm going to look for that video I was watching on Inside Edition, because I am going to, I'm actually not going to play Watch Dogs this week. Not Watch Dogs, what was it? Right, Uncharted. I did another Madden video this week, which I'm probably going to upload, in a second for this week's Andy Plays. I'll probably play it, coming up. Let's see if I can find it. No, that wouldn't be it. No. No, it's around here somewhere. I just have to find it. Yeah, here it is. This is the video that got people outraged yesterday from Inside Edition.
There's anger today that hundreds of hospital beds are empty while
Yeah, we'll play this
coronavirus
video.
patients are...
Let me just see if I can get it in 1080. There we go. Watch this video, folks, because this video made me angry yesterday. I'll put it on in a second. Let's see. Yeah, here we go. Here's the video.
There's anger today that hundreds of hospital beds are empty while coronavirus patients are dying in overcrowded hospitals. New Yorkers cheered when the U.S. Navy ship the Comfort, docked behind me here, arrived with 1,000 beds and 1,200 highly trained medical personnel. As you can see, they've actually hung up coverings over the fencing there to stop people from congregating and taking pictures. But so far, it's been cold comfort. The ship is empty for the most part. There's only about 20 patients or so on board receiving treatment, and that is infuriating lots of people. There's a similar situation in Los Angeles, where the hospital ship Mercy had only 15 patients on board today, all due to bureaucratic red tape. The situation is being called a joke and ridiculous. The New York Times quotes health officials. Guam, the commander of the nuclear-powered aircraft carrier Theodore Roosevelt, makes a lonely last walk down the gangway to the cheers of sailors who chanted his name. Captain Crozier was fired after raising concerns about a Covid-19 outbreak on his ship. Wrongfully relieved of command, but did right by the sailors, wrote the sailor who uploaded the video. A second CNN anchor has tested positive for coronavirus. Brooke Baldwin tweeted, "It came on suddenly yesterday afternoon. Chills, aches, fever," she posted. She said she has mild symptoms. "I'm one of the lucky ones." And there's an about face today about wearing masks. After weeks of advising Americans only to wear masks if they have symptoms, health officials say everyone should cover their faces outside.
The mayors of New York and Los Angeles are now asking their residents to wear masks, scarves, anything they have to cover their faces.
Even some network news reporters are wearing masks on the air. But look at this crowded New York subway car. Passengers crushed together. No social distancing possible.
I got on the D train, all the seats were taken, and there were people standing up.
At this nurses' protest outside a New York hospital today, people are crowded together despite the obvious danger.
This virus is everywhere. It's on every surface. If you touch a counter, if you touch a doorknob, if you open a drawer.
At this church in Sacramento, California, more than 70 worshipers and 3 pastors have contracted coronavirus. And look, an ecstatic Oprah is reunited with longtime companion Stedman Graham after he spent 14 days in self-isolation.
Alright, folks, so I see something interesting on my suggestions. Now, if you haven't heard about Anthony Fauci, the rock star doctor, apparently now he's receiving death threats. So let's watch this video regarding Dr. Fauci.
Dr. Anthony. Dr. Anthony Fauci has been given a security detail because of death threats. The Washington Post reports America's key pandemic expert has become a public target for right-wing commentators and bloggers. The 79-year-old is being guarded by U.S. Marshals.
Dr. Fauci is going to get, if he doesn't already have, a security detail of more than a half dozen federal agents.
President Trump intervened when Fauci was asked about the threats.
He is a neat security. Everybody loves him. Says that they'd be in big trouble if they ever attack.
He spoke to Gayle King about the threats on CBS This Morning.
You know, it's my job. This is the life I've chosen, and I'm doing it. I mean, obviously, there's a lot of pressure. I mean, I would be foolish to deny that, but that's what I do.
And the crisis is bringing out some craziness. The FBI says that an engine driver deliberately crashed his locomotive in the port of Los Angeles in an attempt to damage the hospital ship Mercy. You can see gouges in the road made by the engine, but it stopped 300 yards away.
Okay, folks, I am sorry to stop playing abruptly the video, but I just got this important message from Nassau County. So, Justin, if you're still watching this, you may want to pay attention. We got breaking news from Nassau County right now. I just got this text message on my phone. I'll quickly mention, if you are in Nassau County and you want to get notifications from the county, because I'm doing it because, again, I have many of my viewers who are in Nassau, you can text Coivd19, capital letters NC, to 888-777. Again, that is Coivd19 NC to 888-777. If you are in New York City, you can text, I'm trying to see what the number is, COVID to 692-692. Okay. So, I just got this text message in from Nassau County right now, and I quote, County Executive Laura Curran, the Commissioner of the Nassau County Police Department, Patrick Ryder, and Office of Emergency Management Commissioner Stephen Morelli announced today that Nassau County is accepting donations of medical supplies during this unprecedented national state of emergency. Alright, here we go. We encourage donations in the below medical supplies in unopened boxes and packages of N95 surgical masks, unopened container and boxes, eye protection such as goggles and face shields, nitrile gloves, and unopened boxes which have not been expired, disposable medical gowns, paper and which are fluid resistant or plastic, shoe cover booties, no-touch thermometers, thermometer probe covers, HEPA filters for ventilators, anesthesia machines. I guess they can convert the anesthesia machines to ventilators. That is a possibility. I heard New Jersey was looking into that. Antibacterial and disinfecting wipes, typical alcohol or bleach-based disinfecting wipes, Clorox or Lysol, or hand sanitizer. Okay, there is a drive-up collection point at the Nassau County Police Department HQ. So, wow, the first precinct in Mineola. Interesting. Okay. So, the first precinct is accepting donations 5 days a week, Monday through Friday in Mineola, from 10 a.m. to 3 p.m. Rear entrance is on 14th Street in Mineola. Okay, so there you go. Because I took this link from my, I'm going to save this, by the way. There we go. Now I can find it for next time. If I just type in Nassau County on the search bar for Chrome, then it will come up. That's simple. Okay, let me put my camera back on. Hello! Okay, yeah, I'll just check the comments one more time. If anybody has something to say to me now, you're more than welcome to. I don't see anything on there. I don't see anything on Twitter right now. Let me check Twitter. Oh, okay. This the R32s. I don't want to get into that. So, I think with that, I'm going to wrap this up. I have nothing else to say. I mean, Nassau County isn't giving an update. I don't see anything from News 12 Long Island, so I don't really see anything. So if Nassau County isn't giving an update, then I guess I'm going to wrap this up. Alright, so thank you all very much for watching. WrestleMania prediction video is up. Get your mind off of the world. I know I'll have the Madden gameplay tomorrow, and I think I'll tape another episode of Andy Plays. I think I'll probably tape on Monday afternoon since I'm not really doing anything. And since I'm going to watch Jeopardy later on. So, yeah, that's pretty much it. Stay healthy. Take care.
This has been an Andy's Randomness special report.